Hello, my name is Ariane Herrick. I'm from the University of Manchester in the UK, and I'm very pleased to give a short introduction to systemic sclerosis with a focus on Raynaud's phenomenon and on digital ulcers. Systemic sclerosis is a multi-system connective tissue disease. It is often associated with major internal organ involvement, as demonstrated on this slide here. And it's the internal organ involvement which is responsible for the high mortality of the disease. Two of the most characteristic clinical manifestations of systemic sclerosis are digital vasculopathy, which is the subject of this talk, and skin thickening, or scleroderma. The term scleroderma means hard skin, and it's often a term which is used interchangeably with systemic sclerosis, although technically this is incorrect because scleroderma is simply one manifestation, albeit the most characteristic manifestation of the disease systemic sclerosis. And you can see here in the fingers that the skin is so tight that this has caused contracture or bending of the fingers. And you can imagine how debilitating this is. And if you look carefully, you can see how on the little fingers there are small sores or ulcers. And we're going to be talking about that just now. So I'm going to run through the different points on this slide. My talk focuses on systemic sclerosis, digital vasculopathy, the subject of this special interest group. What is digital vasculopathy? How common is it? How does it impact on quality of life? And why are outcome measures so important? So first of all, what is digital vasculopathy? Well, it's a spectrum, and it encompasses Raynaud's phenomenon, digital ulceration, and critical digital ischemia. And I'll be going through each of these in turn. But first of all, I would like to make one or two general points. First of all, Raynaud's phenomenon is very common. It means episodic color change of the fingers in the cold or in response to emotional stress, and it occurs in 5 to 10% of the population. And usually it's what we call primary or idiopathic Raynaud's phenomenon, which means that there is no underlying cause. However, Raynaud's can be associated with a number of different conditions, and these include connective tissue diseases, particularly systemic sclerosis. Digital ulceration, another part of the spectrum, and again, we're going to come back to that. Importantly, it does not occur in primary Raynaud's phenomenon. Critical digital ischemia is a serious but rare part of the spectrum of digital vasculopathy. So first of all, Raynaud's phenomenon. The classic triphasic color change, and not all patients experience 3 color changes, is that the fingers first of all turn white with vasospasm, with constriction of the blood vessels supplying the fingers. They then turn blue or purple when the blood supplying the fingers is deprived of oxygen, the so-called deoxygenation phase. And then as the blood supply is returning to the fingers, you get this redness, the reperfusion phase. And that's often the most uncomfortable phase because it can be really quite painful. So what are digital ulcers? Digital ulcers are sores of the fingers or toes. And some examples are shown in the picture here. Now, there are many different types of digital ulcers, and the digital ulcers can commonly occur on the tips of the fingers, as shown in A, digital tip ulcers. They can occur on what we call the extensor aspects of the fingers, particularly as shown in B, when the fingers are contracted or bent by the skin thickening or scleroderma. And then the skin can be stretched, and it's of course very liable to low-grade trauma because of the contractures, and you can have ulcers forming. Ulcers can form over areas of calcinosis. About 20 to 40% of patients with systemic sclerosis develop these calcium-containing lumps beneath the skin, commonly in the fingers, and these can extrude through skin and cause an ulcer as shown in C. And less common sites of ulcers are shown in E and F at the side of the finger or at the nail bed. And you can see from these pictures how painful and disabling ulcers can be. So how common are the different aspects of systemic sclerosis digital vasculopathy? Well, they are very common, particularly the Raynaud phenomenon, which is almost universal in patients with systemic sclerosis. Over 90% of patients with systemic sclerosis have Raynaud's, and it's often, as I said earlier, very severe. Digital ulceration is common. Approximately 50% of patients at some point in their disease course, if they have systemic sclerosis, will have one or more digital ulcers. And this has been shown in many studies, some of which are shown here. Critical ischemia, shown in the bottom right of the picture, is much less common than digital ulceration, but as you can see, can be very severe. Here it's progressed to gangrene and is always a medical emergency. I won't say any more about critical ischemia today. So how do Raynaud's phenomenon and digital ulceration impact on quality of life? Because Raynaud's can be so severe in patients with systemic sclerosis, it has a major impact on quality of life. And that's even in the summer months when the temperatures are warmer. And this was shown recently in a Scandinavian study. Digital ulceration can have a huge impact. This is because digital ulcers are often excruciating. They can keep patients awake at night. They very often result in significantly impaired hand function, resulting in disability, including work disability. And this is now very well recognized. And finally, why are outcome measures so important? They're important in our clinical practice, and they're important in research. In clinical practice, we need outcome measures to allow assessment of whether the Raynaud's or digital ulceration is improving, is stable, or progressing. We badly need them in research practice because our current outcome measures for Raynaud's phenomenon and digital ulceration are not good. And this has hampered clinical trials. We very much need objective, reliable, and feasible outcome measures to facilitate much needed clinical trials, because as many of you know, our current treatments for Raynaud's phenomenon and for digital ulceration are very far from perfect. So in conclusion, Raynaud's phenomenon and digital ulceration are common in patients with systemic sclerosis, and they have a very major impact on quality of life. Our current treatments for Raynaud's and digital ulceration are often only poorly effective, if at all. And so improved outcome measures are needed because these will facilitate clinical trials of promising new treatments. Thank you very much for listening.